We are starting today's show with information we can all use for your health. If you are not feeling well, when do you go to an urgent care facility, and when do you make an appointment with your doctor right out of the gate? Well, Dr. Andrew Carroll back with us today. How are you?
Hi, I'm good. How are you doing?
Did you have a nice Father's Day?
Yeah, I heard that you didn't get a lot of sleep last night and late dinner and everything.
Yes, you were listening to the morning news. Now, do you have a couple kids?
I have two. I have a 5 and a 3-year-old.
So you had a special dad's day.
We had a great day.
Wonderful. I'm glad you weren't sick or anyone in your home.
Yeah, we were good.
Talking to a lot of families out there, a lot of kids have been sick. It's bizarre. They didn't miss any school, and then boom, all summer they've been wrestling with these ailments. And the big question for so many of us is, when do you head to the urgent care? And when do you wait for an appointment the next day or Monday?
80% of, I would say 80% of my phone calls after hours are people wondering if this illness is something that they can wait till the next day to see their doctor for, or if they need to go to an urgent care. I like to talk about this in terms of degrees of illness. Mild illness being things like colds and coughs and the sniffles and sinus infections and maybe even the flu. These are things that I usually would recommend people see their primary care physician for. And you want to see your doctor because, one, you don't have to do all the paperwork like you would if at an urgent care. Usually the co-pays are a lot less if you're seeing your physician as compared to an urgent care. These are things that, if you call your doctor's office and they say, we can get you in tomorrow, these are the things that you can wait for.
The non-life-threatening illnesses.
Exactly, the non-serious, non-life-threatening illnesses.
Okay.
And then the moderate illnesses are those things that, like more severe illnesses like flu, where you do want to be seen within 24 hours. So if it's cold and flu season, it's, here it's November to April, and you have high fevers and congestion and cough and maybe body aches and everything, and you think it may be the flu, that's something that you really want to be seen within 24 hours for.
And what does 24 hours really help you with? What are you going to get, antibiotics in your system?
With the flu is one of the few illnesses that you can treat, but it has to be within 24 or 48 hours. So if your doctor says, well,
Did not know that.
Yeah, there's medication, there's Tamiflu and Relenza are the two biggies. If you call your doctor and say, I think I have the flu, well, we can't get you in for 3 or 4 days, which is pretty typical during flu season. That's the kind of thing that you actually do want to proceed to an urgent care for.
And you need to kind of be careful that it's not allergies versus flu.
Right.
And a lot of people are struggling with allergies because of our wet.
Yeah, I don't think it's necessary for people to rush to an urgent care for allergies. Urgent care is for those things that maybe not the severity that you would want to go in an emergency room for, and we're going to go over that now, is the...
Yeah, let's go through those really dangerous ones.
The major ABCs, airway, breathing, and circulation. If your illness compromises any of those three things, an airway would be like severe or critical asthma, or drowning, or other really bad respiratory illnesses.
What about chest pain?
Chest pain, obviously. Squeezing, crushing substernal chest pain in people who are susceptible for heart attacks, men and women in their 50s and 60s, or people with sweatiness and shortness of breath who have diabetes. Because diabetics don't get the chest pain of heart attacks.
I did not know that.
They get
I'm sorry, and circulation as well?
Circulation would be things like strokes, sudden onset of confusion, problems using a limb, problems with gait. If you have an elderly person who all of a sudden doesn't recognize where they are, who you are, that's the kind of person that you want to rush to an emergency room.
Could be a stroke or something like that.
Exactly.
Okay, so that's really important, folks. We're going to be taking your calls. Actually, we're going to take your top 5 questions. So call in right now. That's the phone number, 685-3080. You will talk to producer, tell her your question, and then Dr. Carroll and I will answer, or he'll answer them, right after this. All right, thank you, Daphne. Taking your questions now on Your Health with Dr. Andrew Carroll. And our first caller wants to know if the symptoms of a heart attack, or how the symptoms of a heart attack are different if you are a diabetic.
Diabetics start to lose their neurologic function progressively, so they start to lose the sensation of pain. They may notice it more in their fingers and toes to begin with, but what happens is when they get a heart attack, they don't feel the pain. So the symptoms tend to be those other symptoms that come along with a heart attack. Severe sweatiness and shortness of breath may be the only 2 signs they get when they're having a heart attack. And so diabetics need to be keyed into that. If they're starting to get, for some reason, unexplained shortness of breath and sweatiness, they may need to think about whether or not they may be having a heart attack.
Okay, our next caller is in her 50s. She just broke her elbow, she says. She has severe back spasms, and she's wondering how she can get rid of the pain.
First off, you should probably already have seen a physician if you've broken your elbow getting the back spasms. Things that you need to do in order to make sure that you're not going to get any worse is to try to maintain the kind of activity that you've already been doing. So If you exercise or you walk a block or two or maybe a half mile a day, you want to continue doing that, because we found that the more that you stay and just sit on a couch and do nothing, the more likely you are to have that illness, the pain progress and stay around longer. The faster you can get back to the activities that you're used to doing, the better off you're going to be long term.
Okay, our next caller, blood and mucus in her stool. Wondering what that might be a sign of.
Blood and mucus in the stool, it depends on funny enough, it depends on what color the blood. If it's bright red, if it's bright red blood, you may think about something externally, something like a hemorrhoid or a fissure of the anus. If it's a darker stool or even a black stool, you need to think about internal bleeding. If you've got blood and mucus with diarrhea and you've been into a foreign country recently, think about things like salmonella or shigella. If this is something that's new, sudden onset, and severe diarrhea along with that blood, you need to be seen by a physician.
You know, we just watched a big Oprah episode. I have to admit, you probably watched it with me, folks. And she talked about how really you should be looking at your stool every day, because it can tell you a lot about your health. Oh, you're not so, you know.
Well, no, you should. I mean, you should be aware of it, but I think people are aware of not only the character of their stool, but their stool habits. So if all of a sudden you're not able to stool 3 or 4 days, that can be a sign of something going on.
Or dehydration.
Or dehydration, around here especially.
It's just, it can be kind of a nice little watch for you. All right, a 50-year-old male calling in with his blood pressure steadily rising over the last week, wondering if he should rush to urgent care or what he should be doing here.
Well,
sign of hypertension?
Hypertension that is a sign of hypertension. There aren't a whole lot of symptoms to hypertension until it's usually too late. If you're noticing, if you're going to the grocery store and you're finding that your blood pressure is rising steadily, you probably need to be evaluated by your doctor and see if there may be something going on inside of you that's causing this. If you've got severe obesity and that's part of it, you need to be checked for that. Also, there are certain illnesses, one of them being called pheochromocytoma, which is a adrenal gland disorder and a kidney disorder, which can cause your blood pressure to rise uncontrollably, and you need to nip that in the bud right away.
Okay, another question, if it's urgent or not. 45-year-old woman with severe swelling in her left foot and her upper leg and a lot of redness as well.
Okay.
What should she do?
That sounds like it's probably an infection. If there's swelling, it's usually fluid. If it's red, that usually means infection or inflammation. So if you can get in to see your doctor, you should, and it should be within the next 24 hours, because if you get a skin infection like that, especially if it's on the upper leg, you want to get that treated with some antibiotics as soon as possible.
Wow, helpful information. Thank you so much for calling, and we're going to do this every Monday, so make sure you put that on your calendar. Dr. Andrew Carroll, as always, thank you.
Thank you, Tracy.
Very much.